Welcome to This Week in Anesthesiology. This week we are covering several notable papers spanning advanced perioperative monitoring, targeted regional anesthesia, and pediatric airway management. Let us dive in. We begin with major developments in perioperative monitoring and hemodynamic management. For decades, the routine use of pulmonary artery catheters in cardiac surgery has been a source of intense debate. In the PUMA Pilot trial, Perry and colleagues evaluated the feasibility of a large-scale randomized trial comparing pulmonary artery catheters to central venous catheters in low-risk cardiac surgery. Screening 480 patients, they randomized 149 adults undergoing coronary artery bypass or aortic surgery. The trial demonstrated outstanding protocol compliance at 99%, proving that a definitive trial is highly feasible. Interestingly, although the study was not powered for clinical outcomes, the group randomized to receive a pulmonary artery catheter experienced a higher rate of acute kidney injury, at 34% compared to 19% in the central venous catheter group. This signal suggests that our choice of invasive monitoring may carry unintended consequences, highlighting the need for a larger trial to fully guide international recommendations. In a parallel effort to optimize perfusion, Albanese and colleagues writing in Anesthesia and Analgesia validated a novel algorithm for continuous real-time assessment of cerebral autoregulation. By analyzing the dynamic interactions between mean arterial pressure and cerebral oxygen saturation measured via near-infrared spectroscopy, the algorithm calculates a cerebral autoregulation index. When validated in 71 surgical patients, the algorithm demonstrated high accuracy in identifying the limits of autoregulation, achieving an area under the receiver operating characteristic curve of 0.92, with a sensitivity of 82% and a specificity of 94% at a threshold of 45. This continuous index could soon allow clinicians to move away from generic blood pressure targets and instead personalize mean arterial pressure to protect the brain. Next, we turn to regional anesthesia and postoperative pain management, where anatomical precision and long-term outcomes are taking center stage. In regional anesthesia and pain medicine, Zimmerman and colleagues published a comprehensive narrative review of 32 studies mapping the sensory innervation and nociceptor distribution of the knee joint. They found marked spatial heterogeneity, with the anterior capsule containing the highest density of nociceptors, while the posterior cruciate ligament showed a greater density of these receptors than the anterior cruciate ligament. Innervation consistently arises from overlapping branches of the femoral, sciatic, and obturator nerves. This detailed mapping provides a critical anatomical blueprint for anesthesiologists to refine targeted regional blocks and radiofrequency denervation techniques. While localized interventions aim to limit systemic medications, post-surgical opioid management remains a major public health challenge. In a massive systematic review and meta-analysis also, Frangakis and colleagues investigated the incidence of new persistent opioid use among more than 6 million opioid-naive surgical patients in the United States. They found that approximately 7% of these patients developed persistent opioid use postoperatively. The incidence was highly dependent on the definition used, reaching over 8% in studies defining persistence as continued use between 90 and 180 days, compared to just under 3% in studies requiring a full 180 days of documented use. These findings underscore the urgent need for robust, non-opioid multimodal pain strategies across all surgical specialties. We also saw important updates in pediatric anesthesia and clinical decision support. In Anesthesia and Analgesia, Black and colleagues reviewed over 1,800 anesthetics administered to patients with spinal muscular atrophy at a major quaternary pediatric hospital. They found that nearly 79% of these procedures were for lumbar punctures to administer nusinersen, with 88% of those cases successfully managed using a natural airway or a pre-existing tracheostomy. However, for the subset of patients requiring general anesthesia with endotracheal intubation, the incidence of difficult intubation was remarkably high at over 9%. Despite this airway challenge, the overall rate of severe anesthesia-related adverse events was reassuringly low at just 0.33%. Finally, in the domain of clinical decision support, Tontu and colleagues writing in the Journal of Clinical Anesthesia evaluated a ChatGPT-based framework to assist with the interpretation of arterial blood gases. Utilizing a hybrid Stewart and standard base excess model in over 1,200 intensive care unit patients, the artificial intelligence framework demonstrated a 93% clinical concordance rate with independent anesthesiologist assessments. The concordance was particularly strong, exceeding 96% in patients with sepsis, renal, and metabolic diagnoses. While prospective validation is still required, this study highlights the growing potential of artificial intelligence to serve as an adjunctive bedside reporting and educational tool. If you only have time for one paper this week, make it the PUMA Pilot trial in anesthesia. While many clinicians routinely place pulmonary artery catheters in cardiac surgery, this pilot trial not only proves we can successfully run a large-scale randomized trial to settle this debate, but its signal of increased acute kidney injury in the catheter group should make us pause and carefully consider our monitoring choices today. Here are the key takeaways from this week in anesthesiology. First, a large-scale randomized trial comparing pulmonary artery and central venous catheters in cardiac surgery is highly feasible, and early pilot data suggests we should remain vigilant about potential complications like acute kidney injury. Second, continuous real-time cerebral autoregulation monitoring using mean arterial pressure and near-infrared spectroscopy is highly accurate and may soon allow for personalized hemodynamic management. Third, the anterior joint capsule represents the primary nociceptive zone of the knee, which should guide the placement of targeted regional blocks and denervation procedures. Fourth, roughly 7% of opioid-naive patients in the United States develop new persistent opioid use postoperatively, underscoring the urgency of opioid-sparing pathways. And finally, patients with spinal muscular atrophy face a nearly 10% risk of difficult intubation when general anesthesia is required, though overall procedural complications remain low. That's your roundup for this week in anesthesiology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence which can make mistakes. Always review the original source materials.